All right, we should be all good.
Hi everyone, this is Jason Becker from Pilot NFP, and I'm joined by Amanda Reese, our Medicare specialist from the team at NFP. This session is to help inform you and answer any questions that you might have about Medicare, including topics like when you need to enroll in Medicare, if you're approaching Medicare eligibility, how Medicare works if you're currently on Medicare and also on the WellLife network plan, the differences between Medicare Advantage A and B, what they cover, what the costs are, Medicare Advantage for supplemental plans, and what you can do to change your plans once you have them, including a few other topics. So we hope this is a great resource for WellLife Network employees, and this session is also being recorded, and you will have access to view this at any time at your convenience, or when questions pop up, or if you want to go over to anything with your friends and family. So we think there'll be a lot of valuable information here, and I will turn it over to Amanda to start the presentation.
Thank you, Jason. Hi, everyone. My name is Amanda Reese. I'm going to be taking you through this presentation today with Medicare. We're just going to go over some basics as well as kind of dive into what do you do and some questions that you might have. I also have two colleagues with me, Ari Hutt and Rita Schoenfeld, and I will be sharing their contact information at the end so that you would be able to reach out directly if you have any personal questions. So the first thing we're going to do is just go over a few topics. Some of the main things are, when are you going to enroll? What are A and B of Medicare? What do they cover? How do you get them? The difference between an Advantage and a supplemental plan. So we'll explain exactly what that difference is. We'll talk about prescription coverage, the extras like dental and vision that you're used to having on your group plan, and how to avoid any penalties. So we'll be able to help you transition from the company insurance to Medicare without penalties. That is our goal. So we'll help you explain timelines and things like that. The first thing we're going to do is just talk about Medicare in general. So Medicare is a government system, and it's based on your age. It is not the same as Medicaid, which is income-based, not age-based. So they are different. You can have both, but most people will qualify for Medicare when you turn 65. You would sign up for Medicare through Social Security because it is a federal health insurance program. And the A and the B are the parts that we would get from Social Security, and they're also called Original Medicare. Another time that you're going to be eligible for Medicare is if you are deemed disabled and under 65. After 24 months, you do get A and B of Medicare given to you. When to sign up for Medicare? So the most popular time of the year that people would sign up is during their initial enrollment period. And this is going to be the first 3 months before you turn 65, the month of your birthday you turn 65, and 3 months after. Medicare, though, is not auto enrolled. So you do have to reach out to Social Security to enroll in parts A and B in a timely manner, unless you're collecting Social Security benefits prior to 65. So the only time the government auto enrolls you into A and B is if you're collecting benefits prior to 65 from Social Security. Other than that, we do have to do something. It is very important that we do not miss your enrollment period or deadlines to help you not get those penalties. Again, if you're under 65 and disabled for 24 months, you will be auto enrolled into A and B, so you won't need to do anything. The easiest way to sign up for A and B is online. So we do walk you through the Social Security website to help you know where to click, what accounts to open, because you do have to have a Social Security account. But again, we walk you through that whole process. We kind of help you hold your hand during that situation, so you don't have to do it yourself. A big question we get is, what if you are still working? So the qualifications are if you are working full-time and are currently an active employee working for a company with more than 20 employees. You do not have to get Part B as in boy, but you are still wanting to enroll in Part A as in apple. So we still want to make sure that you enroll in A as in apple unless you're contributing to an HSA type medical coverage. If your company is not over 20 employees or you move to part-time or go to retire, you will need Part B immediately. So Part B is going to be needed even if you want to stay on what they call COBRA after you retire. Medicare automatically becomes primary no matter what. So we will definitely need to have you fill out those forms, communicate with Social Security, and let them know that we need to start your Part B. You can start your Part B on the first of any month during the year. So if you retire April, if you're going to retire at the end of the year for January 1st, it doesn't matter. Medicare can start on the first of any month, any time of the year. Here are some eligibility periods. So if you turn 65 during that initial enrollment period and you do not need to get Part B, then we can use that SEP, which is called a special enrollment period, to get you that Medicare Part B any time of the year. So Medicare will only start on the first of any month, but it is important to know that you can do it any time of the year. If you do miss any of your enrollment periods, the government does allow a general enrollment period between January 1st and March 31st that you can sign up for your A and B through Social Security. Again, we are going to help you through everything. So I want to just make sure you guys know, as long as you reach out to us, we can help you through it to make sure that no penalties are, put on your account. Now, I want to dive into Medicare first, but before I do so, I do just want to also talk about, and just back up a slide for, are you still working? So there are some questions we've had from some employees about having Medicare A and B while on your company insurance plan. So what this does is your insurance plan with the company will always be primary. So you would be able to have A and B as secondary, but for Part B, you pay based on your income level. So the least amount that you will pay every month is $185. And Medicare Part B will most likely not pay more than $185 as a secondary insurance. So honestly, while you are on the company insurance plan, having Part B is not needed. And you will not get a penalty if you do not have Part B or if you decide to drop Part B, if you do currently have it. So I apologize. I just wanted to make that note just so everyone is aware of that. So we're going to talk about exactly what the A and B of Medicare through Social Security covers. So Part A is your hospital coverage. So the main part of Part A's coverage is your inpatient hospital care. So think the four walls and the bed of your hospital room when you stay overnight. It also pays a small portion of skilled nursing, which is inpatient rehabs, some hospice, and home health care. Home health care is important to note. It's not custodial care. So home health care, we're talking about bandage changing, at-home physical therapy, not bathing, dressing, eating, things like that. With Part A, as long as you've worked 40 quarters or 10 years of your life, you will not pay a premium to have Part A. This is why we sign you up for Part A immediately once you turn 65, because for 95% of the population in the country, you will not be paying for Part A anyway. If you go to use Part A, you will have to pay the first $1,676. So again, just getting back to if you have Medicare as a secondary, if you go into the hospital, your WellLife insurance plan would pay first, and then Part A would pay, but Part A says that you are responsible for the first $1,676. So Medicare Part A is not going to pay anything until you've satisfied that $1,676 first. Part B is the other part of original Medicare that we get from Social Security. And Part B is called your doctor's coverage or medical coverage. This includes your doctor's office visits, your doctor's surgeries, testing, so think CAT scans, MRIs, x-rays, your lab work, therapy visits, so whether it's mental health, physical, occupational, speech therapy, your durable medical equipment. There also is some Part B prescription drugs that are covered. So these are like the chemos and different things like that that are administered at your doctor's office. All of this is covered under Part B. So Part B starts at $185 for 2025. We do not have the 2026 rates yet. They come out in late November, early December by the government. But for right now, the lowest you will pay for Part B is $185. If you go to use Part B, you will have to pay the first $257 a year. That is the deductible. Then Part B covers everything at 80%. So you would be responsible for 20%. So again, if we're getting back to having Medicare as your secondary, WellLife would pay first, and then Part B would kick in and say, okay, you have to pay the first $257 for the year. That's your deductible. And then we'll pay 80%, leaving you with 20%. The next items we are going to talk about are going to be the plans that you choose from the different private insurance carriers. So the government only gives you A and B. If you realize that they don't cover any prescriptions at the pharmacy. So we're going to talk about how you need to purchase your own prescription coverage, as well as some medical coverage to help cover those deductibles and coinsurance that the A and B do not cover. The first plans we're going to talk about is what they call Part Cs. They're called Advantage plans, and these are the types of plans that you see on your TV and that are being mailed to you in all those different flyers, especially this time of year if you're of age. These types of plans are HMO and PPO type plans. And again, you're going to purchase them from private insurance carriers. So we're talking like the Aetnas, Humanas, Blue Crosses of the world. These plans become primary. So your Medicare A and B actually pay the insurance company to have you as a client. The insurance company now says that you can only use these doctors in this network, and then they give you a list of different types of copays for each procedure. These are the plans that we can change on a yearly basis this time of year. So from October 15th to December 7th of every year, we can change your Advantage plan. So as your needs change, as your networks change, we can also help you change from year to year to help make sure that the plan is the best plan for you. Again, these plans do have some out of pocket. They're very similar to the type of plan that you're used to under your company insurance. They also include your prescription drug plans as a part of the insurance, as well as dental, vision, and some gym memberships. So you essentially have one card, again, like you're used to with your company insurance, that you show everywhere and are able to use. To dive into a little bit of prescription drug coverage. So prescription drug plans are based solely on your zip code. Each plan differs in the type of drugs that they cover and the copays that they make you pay for each drug. They also differ in what pharmacies you can go to. So at this point with prescription drug coverage, our job is to gather your list of medications and preferred pharmacy. And what we do is we actually put it in the system and are able to help you determine exactly what every med will cover for the year. There is a late enrollment penalty that could be acquired under the prescription drug plan. And this is if you go 63 days or longer without prescription coverage. Again, so if you're covered under the company insurance, you are okay. That does not count. But if you go any longer than 63 days with no prescription coverage, the government will penalize you for not having a prescription drug plan. Each of these plans reset each calendar year. So you're looking at a January 1st to December 31st plan year. These are also the plans that we can change once a year during this time from October 15th to December 7th. Bear with me a second. I'm just going to make sure everyone is on mute. Perfect. So how the plans work is most plans have a deductible. So for 2025, the maximum deductible is $590. For 2026, the most you can pay in a deductible is $615. Then what happens is you go to a copay stage, and the most the government says that you can pay in prescription coverage is $2,000 at the pharmacy in copays. So once you would pay $2,000, all your drugs are fully covered at 100% until December 31st of that year. Then in January, the deductible starts over, you move to the copay stage, and for 2026, say, the government says that the most you can pay is $2,100. Again, once you reach that annual limit, all your drugs are covered for free until the end of that calendar year. You're able to get prescription drug coverage as a part of that Advantage plan that we just spoke about. You can also have it as a standalone plan as well. So there is a way to have your Medicare as primary and have a standalone prescription drug plan. I just wanted to take you through the Inflation Reduction Act. This is the government's program that is helping your out-of-pocket with Medicare. So 2025, this is the year that the government implemented the $2,000 cap in prescription copays. For next year going forward, the government is also going to start negotiating down drug prices for Medicare plans. So for example, things like Eliquis that this year cost, $500 to $600 a month, we're seeing next year are costing $250, maybe $300 a month. So it is helping save our clients, and that's full price, by the way, that's not a copay. But I just want to give you an idea of the reduction in prices that the government's helping for everyone. The other way you can be covered is having that A and B of Medicare and keeping it as your primary insurance. What we would then do is get you a secondary supplemental plan. The most popular plans in the United States are Plan G as in George and N as in Nancy. These plans have a monthly premium, but for example, with Plan G, the only out-of-pocket you would have for all your medical bills for a calendar year would be that Part B deductible that I mentioned before of $257. So you would essentially pay your first doctor's appointment in full, and then going forward, everything else, it doesn't matter if it's a hospital stay, surgery, office visit, therapy visit, but you would no longer have any out-of-pocket. These are the plans, again, that are secondary. So your Medicare A and B are primary, which allows you to go to every hospital in the country, as well as any doctor that accepts Medicare, which is 90% of all the doctors in the country. This is where we would get you a prescription drug plan as a standalone policy. So you would have your A and B Medicare card that you would show. You would have a supplemental card that goes with your Medicare to help pay what A and B do not, and another card for just your pharmacy. So you would have your prescription card that you would only show at the pharmacy. I want to be able to show you side by side the differences between having an Advantage and a Medicare supplemental plan. This is the biggest decision that you're going to make when you're looking at Medicare insurance. There are some states where you can be locked out for medical underwriting. So making that decision when you first are eligible is ideal since you have access to any plan on the market at that time. Again, for both plans, we need to sign you up for the A and B of Medicare with Social Security. If you choose an Advantage plan, then your Medicare is no longer your primary. So most plans cost nothing to have each month, but they do set you into a network of doctors and hospitals and allocate copays and out-of-pocket cost for every procedure, from specialist visits to surgeries to physical therapy, copays. The Medicare Advantage plan is all inclusive. So you have one ID card that works for your medical, your prescription, offer dental, and vision. These plans also offer some extras most of the time, like gym memberships and some over-the-counter money. But again, just be mindful that network is the biggest thing that we are looking at because we want to make sure that you can go to the doctors and hospitals that you would like. How that differs from a Medicare supplement is that your Medicare, again, is your primary insurance. So that allows you to go to any hospital in the country and 90% of all the doctors that accept Medicare in the country. The supplemental plans, which again are through private insurance carriers, you would be getting, you would be having a secondary. So there's no additional networks for the secondary plan. You just have Medicare. These are the plans that do have very minimal out of pocket. So your copays and what you pay for your medical is going to be very low. You would also be able to get a separate prescription plan, which allows you to customize your level of Medicare coverage for the medical, as well as your level of prescription coverage. These policies do not cover prescription with the supplement. That's why we're purchasing a separate one. And then we're able to add dental and vision as you see fit. Every Medicare plan, whether you get a Medicare Advantage or a Medicare supplemental plan, will be one policy per person. So I know right now people are used to having family coverage or husband and wife coverage, but with Medicare, everyone gets their own plan. So you and your spouse can technically have different options if that's what you prefer. Again, especially with the Medicare supplemental side, we can help you find some dental, vision, and hearing benefits to add since those plans do not have that coverage. So there are things that we can do. Again, those types of plans are network based. So it's something that we ask who your dentist is, where do you buy glasses, and we're able to find coverage that fits where you go. Some other types of insurances that we do offer that may be something you currently have with your company insurance are final expense, which are funeral and burial costs, as well as cancer type of insurance where it gives you a lump sum if, God forbid, you do get a cancer diagnosis. Here's a couple items to consider when we're looking at what plan to choose. So you're going to look at the cost first. So do you prefer to pay a certain amount a month and know exactly what you're going to be paying out of pocket? Or do you prefer to pay a very low cost or nothing per month and only pay when you have to use your insurance? So there's different ways that we can look at things and everyone has their personal preference. Another choice you're going to be making is doctors. So do you prefer to use any doctor that you want, or are you okay with choosing a doctor within a network? Do you have dual residence? Do you travel? Is it something that is your lifestyle that we need to make sure that your Medicare plan works with you? Having Medicare primary, again, allows you to go anywhere in the country. So if you travel a lot or have multiple homes in different states, that is something that we can help you with until you kind of settle into one area. Your personal health history is also going to be a huge factor in your decision. Is it something that we might have to worry about going forward? Do you see a lot of doctors? Do we have to worry about what you're going to be spending out of pocket? Those are the types of things that we can help with. And then also your personal risk level. So, what are you comfortable with? Are you comfortable not really knowing what you're going to spend on medical? Or do you prefer to have an exact budget so you know exactly what's going to come out of your bank account and out of your pocket for the year? Just to give you an idea of how we work, I wanted to be able to just show you how our NFP Medicare department helps. So we have a phone call with you and gather some information. We work with all types of plans in all the different states to be able to help find the best plan for you. We work with and make sure that if you're looking at networks or costs and things like that, that we are prepared and know exactly what doctors and medications you use because everyone is different and has a different combination. We work with different companies, so we have multiple options for you. We're not just going to show you one company. And also, we do both the Advantage and the supplemental in each state as well. We help you with timelines so you know when to stay on target. Oh, did someone have a question? Okay, so We will also help you keep on target with timelines to make sure that none of those penalties kick in. We're also able to help you understand going forward what is needed, just so you're prepared. We give you all the documents and help handhold you through the whole process. Plus, we are here throughout the year. So we don't just enroll you and then leave you. We are here. So we are going to be your direct contact going forward. Whether you need to change your plan, you add medication throughout the year, you get a bill you don't understand, you lose your ID card, we are the people that you call. We are here all year long again doing Medicare itself. And we help you provide coverage and different changes from year to year. So as your needs change, we are here to help you navigate through them. So what I'm going to do is just put up Ari and Rita's contact information, but I also wanted to open it up. Anyone can take themselves off mute if you have any questions or anything that you want me to iterate or talk about or anything like that. I wanted to kind of open it up to everyone. You can also put your messages in chat if you would not like to take yourself off mute. But I will also be sending this recording with Ari and Rita's information that you can reach out to them directly. And this way you can do any questions one-on-one with them so that you don't have to ask it in the crowd. And I'll be sending that to Trisha and Barbara to send out to everyone.
But last call for any questions.
All right.
If you want to unmute yourself, you can just click the mic symbol on the top right of the screen and unmute yourself. Okay, well, Amanda, thank you so much for covering all of these topics.
Absolutely.
Very informative, and as we had shared a few times, this you will have access to this presentation and the recording, and along with the where you can also view the slides as well. So WellLife will be sharing that with everyone. So be on the lookout for when that is released.
And thank you so much for your time. Again, I hope this was helpful. And please reach out with any personal questions or any general questions that you might have. You can also text Ari and Rita at those numbers as well. So if you just have a quick question, you can also do that too. And again, thank you for your time.
Looking forward to hearing from all of you. Thank you so much.
Thank you, everyone.